forward. So we've got three great speakers tonight. I've got John Ingleson, who's the chair of Unison Leeds branch, and he is an NHS nurse. And also Joanne Thomas, who is the regional officer for Usdaw and also the chair of the regional TUC. And also I've got Patrick Murphey here from the NEU, which is the biggest teaching union. They're facing particular pressures at the moment. So unless there's an issue with it, I'm going to take John and then Joanne and then Patrick. Is that all right? And then we'll open it up for discussion after the speakers. And I'm hoping that we'll get a good chance to hear what's happening in other workplaces too, what other people's pressures are, and in particular what we can do to help each other. So people all right with that?
Yeah.
Okay, right, well, we'll move straight on then to John Ingleson from Unison. John?
Hiya, Jane, thank you. As you say, I'm an ODP, it's a theatre worker at Leeds Teaching Hospitals and part of Unison branch and the chair. So I was just asked to speak about the situation for PPE and things like that. At the moment, PPE is okay, contrary to what's sort of been the press. At Leeds Teaching Hospitals, at least, it's been, it's always been there. There's not loads of it. It's precious, I think is probably the word to use. We know that we can't waste it, or we sometimes have to use it for slightly longer than we need to, or we should do, but I can't complain. It's always been there for us. I know nationally and in other organisations, it's a different story. In terms of testing, that's been a good story as well. My wife yesterday had some symptoms, and we've all been tested as a family today, and we got that within 12 hours of reporting it. So again, a tick there. The hospitals coped really well. The increased ICU capacity was opened up really quickly, and we've never been under pressure. I'll give a massive tribute to my colleagues in theatres and all the ICU nurses and doctors and what have you, who have had to retrain and do different jobs in the last couple of weeks. I've never done NHS work. I know it's all out there in the press, and we're getting a lot of what's the word? A lot of positivity out there, but it's true. The colleagues I work with have been fantastic at retraining. When we have raised issues in the workplace, they have been listened to, been straight up to board level really quickly, and we've been getting good feedback. So there's obviously issues. There's also new to start with, that there's bound to be teething troubles, but they have listened, and whatever the blips we have, we've managed to get answers fairly quickly. The staff side chair and the Unison branch secretary are also on what's called Bronze Command, which is like the morning briefing and chance to ask questions there. So again, we've got a voice right at the heart of things. Nationally, I think it's a completely different story in the NHS. We've all seen the lack of PPE elsewhere in the newspapers, and the Panorama programme the other night is absolutely disgusting, and I'm sure comrades, you'll all agree with that. And just the historical things of the last 10 years of austerity, meaning we've lost so many staff, so many ICU beds, and a generation of nurses lost with the loss of the nursing bursary. And I think one thing I'd like to campaign on after this would be for those nurses who didn't get a bursary 3 years ago. They're the same nurses or student nurses who are now being asked to work on the front line as band 4, which is a step below nurse on the front line. And they're the ones who were the first generation not to get a bursary. And now they're the first sort of generation asked to step up and put themselves in massive danger. So that's something I want to campaign within my own branch locally, and the Trades Council to consider campaigning around. I feel we've been let down by the Health and Safety Executive as well, in terms of they've been changing their guidance what's needed on the basis of supply, not on the basis of science. And I think when there is an inquiry, or when people ask questions at the end, or when things are a bit calmer, that is certainly a question we need to ask as a movement. Is that okay?
Absolutely, yeah.
Yep.
Thanks ever so much, John, and a huge thanks for what you're doing as well, obviously.
Thank you, Jane.
All right. Okay, should we move on then to Joanne Thomas from Usdaw?
Thanks, Jane, and also to yourself, Ian, for the invite. It's great to be able to join you and see so many people participating. It was probably 5 weeks ago now. I'd never even heard of Zoom, like probably as many of yourselves, and now it's almost becoming a daily part of life. I just think these meetings are so important, you know, just to help, you know, reps, workers, and just make sure that we you know, communicating with the communities, and also it helps us organise, which can become much more effective. So any opportunity that we've got to gather, I just think is absolutely brilliant. And as you all know, unions have played such a crucial role throughout this coronavirus crisis, you know, with the dialogue that we've had with employers, with government. You know, I've never heard the government make reference to us so much as they have done recently, because the seat at the table that we've had has been absolutely needed and I think welcomed. You know, in Usdaw, we represent shop workers, warehouse operatives, distribution workers, food manufacturing, pharmaceutical, all now commonly known as key workers. And it's so important that we take every opportunity as well. And I'd like to do that tonight, if that's all right, to just pay tribute to the key workers, because no doubt there'll be a lot of people actually part of the meeting that are doing the job, you know, frontline workers, nurses, doctors, care workers, cleaners, teachers, you know, all keeping the country going in this absolutely horrendous time. And I do think it's an absolute travesty of how much the frontline workers have been let down by this government, particularly in regards to the lack of PPE and the lack of testing. And it's good to get some good stories like we just heard, but the stories that I'm hearing from particularly Unison and GMB, you know, with regards to the lack of PPE is just absolutely horrendous. You know, I heard the other day that some of the stock that's being used in the care home, which has took, you know, over a month to arrive, was 20 years out of date. You know, some of the things that we're hearing, it's just awful. And at the end of the day, all of the key workers are facing a real, genuine worry every time they go into work. You know, not just for them, but for their families as well. What does that look like? It's absolutely awful. So it's so important, I think, at the minute that unions are listened to, particularly by employers. You know, I've got some good news stories myself as well, because obviously we've been in constant dialogue with companies since the beginning of it, starting with the panic buying. And at that time, that was just awful time to be a shop worker. The panic buying that was going on was just made people so stressful. Some of them had acts of violence taken out against them. But again, we were quick to get round the table and introduce some safety measures. And a lot of what you see now is actually as a result of our dialogue. So we've got the likes of perspex screens, making sure that the customers were limited early on, which wasn't happening at the start of the panic buying, regular deep cleans, making sure that the shop workers have got access to PPE and hand sanitizer, making sure that if they don't want to take cash, they don't have to. Any groceries that are delivered are left on the doorstep. All of those things that we are getting fed from the workforce, our members, basically being put at boardroom level and getting actions and results. Probably is one of the saddest things I think we've faced in Usdaw, unfortunately, at the minute, is the huge rise in abuse against shop workers from customers, and something that unfortunately we're having to, you know, utilise the press for, to sort of raise awareness that this has to stop. There has to be a zero tolerance, because we surveyed over 10,000 members, and people, you know, understandably incredibly busy, but that just goes to show how important they wanted to get their voice heard. And we found out from that survey that actually violence against shop workers has doubled. So at the minute, 1 in 6 shop workers is actually being abused on every single shift. And that just cannot happen. So we're doing everything that we can to raise awareness about that. And after this, obviously, we'll be looking to push legislation like we have done for a lot of years now, very similar to if you strike out or abuse an NHS worker, there's tougher penalties, and we want to see that for all frontline workers. And another good example we had, you might have seen in the press next carried on selling goods in non-food, and we had a huge amount of calls on the back of that, with worried members basically saying that they felt unsafe at work. And again, we managed to act quickly and actually very swiftly next closed the operations. And it was only on the back of sitting down with ourselves, with our representatives, that it's been able to reopen, but only on a voluntary basis with a much reduced headcount. So, you know, people aren't saying they don't want to work; they just want to be going into work where it's safe, which of course is should be the case. And also, it's making sure that we protect our members financially. You know, vulnerable people should not be put at risk. So it's negotiating things like payment for, you know, pregnant women, people that are shielding, people that are off sick and self-isolating, because we can't forget how much an issue poverty is. It is ordinarily, but at the minute, it's just, again, horrendous. I mean, how many people can afford to have a 20% pay cut? I think well-paid people wouldn't be able to afford a 20% pay cut, but how will that affect somebody on low pay? Not just their pocket, but their mental health. So we've got a campaign, along with a number of other trade unions, calling on ensuring that where workers are furloughed, that they're given 100% of their wages, and that should be the case all the time. So in conclusion, I just want to say a couple of points, in particular if there's any reps in the meeting. I just want to say a huge thank you. You know, I don't know what we would have done without our army of reps in Usdaw. You know, the difference that they've made on the ground, not just by representing people, but feeding the information back to us so we can negotiate on their behalf, has been phenomenal. You know, I've always had a huge amount of respect for representatives, but I think currently in this crisis, they've just absolutely made all of the difference. And I think the crisis has also shown how so many workers are just being underpaid and undervalued for years now. And we've been trying to change that narrative, particularly in Usdaw for shop workers. But now I think I know there will be a day of reckoning, and we have to make sure that we carry on this to get the right financial compensation, the respect and the recognition frontline and key workers deserve. We've seen some interim results, like 10% extra week's wage, which has been well received, but quite frankly, it's not enough. So we need to do more, and I've got absolutely no doubt that we will be able to deliver that and push hard for that in the trade union movement. So thanks again very much for the invitation, and just look forward to speaking to everybody as well.
Thanks ever so much, Joanne. I know you work super hard as well because you really care. Really appreciate that update. And there are some of your Usdaw reps on this call tonight. Okay, we'll move on then to the NEU. Patrick Murphy, you're going to tell us the latest from your union, please, Patrick.
Hi, Jane. Hi, and like John and Joanne, I'd like to thank you for the invite to speak to this many local Leeds trade unionists. I would just maybe point out, as people probably know, that throughout this lockdown, schools have been open, despite the overall impression that schools are shut, because they're certainly not operating normally. But on the other hand, schools have been open throughout this to deliver essentially care and some education to the children of key workers, and to some of the most vulnerable children in the city. We've had to try and our members have been keen to do that, and very keen to support those key workers' children and those vulnerable children. The schools have been open even over the Easter break and Good Friday and Easter Monday. I have to say, on a voluntary staffing basis and with time in lieu offered back to workers who come in. But we've had to balance that enthusiasm to look after those key workers' children and vulnerable children against the need for people to be protected themselves at work and not at risk from the virus, and not at risk of spreading it to their families and to the rest of the community. And I'll go through some of the things we've had to take up in the course of doing that. They'll be common to some other trade unions. Some of them will be different. But they probably come under two themes, really. One is managers and employers not wanting to cede control over the way they manage people, because the kind of conflict between bosses and workers at work hasn't ended. It's not on pause because of the lockdown. We've still had to conduct it. That's one theme. And the other theme has been managers and employers seeming to fail to register the seriousness of this crisis and what the reasons for the lockdown are. So the kind of thing I mean by the first of those, which is managers not wanting to cede control of the workplace, is we had a real reluctance at the beginning for some school leaders to accept what self-isolation was and how important it was, and to treat people who had to self-isolate fairly. In other words, to make sure that all of them, teachers or support staff, were on full pay, that any pay they got, any sick pay they got, would not be counted against their entitlement should they get ill later in the year, that any period of sickness wouldn't be part of any triggers. They put them into any sickness absence management processes and things like that. So those things were hard to win at first. They'd been won, but that was part of a symptom of this, which is managers thinking, I don't trust people who are off ill. I think they're swinging the lead. Do I have to pay them? Do I need to still monitor them, and so on? And that's linked to the other aspect of the ceding control bit, which was we had a lot of arguments about the need to pause lots of normal processes that go on at work. We had places still trying to run disciplinaries, run sickness absence processes, even run performance management when people weren't teaching lessons. So how they were going to do that, I don't know. But we had those battles to run, and redundancies, reorganisation of redundancies going on. Now, pretty quickly in most places, we stopped those on the basis that the only thing that should be going on at the minute is stuff that's absolutely urgent and stuff that's connected to looking after these particular children. Everything else is marginal, everything else is not important, everything else goes on pause. But as I say, there were some battles over that. We've still got some places trying to absolutely micromanage the work that people are doing at home. And again, that's an aspect of this managerial kind of sense that, these people are being paid. I'm not in control of them. Are they really putting in the hours and this kind of thing? In some of the worst cases, and this runs right up to this week, I've got people calling me or emailing saying, we're having to fill in a log that proves we're doing 37 hours a week and all this kind of stuff. Many of these people are at home with their own children who haven't got schools to go to, with partners who are working at home and using whatever devices exist in the family. Some of them are very young children. So that lack of understanding that people aren't at work in the normal way, people are doing what they can, and that kind of, and that willingness to trust them seems to be absent in too many cases. We're still having a big argument over something called live streaming of lessons, where some places, not many, I'm glad to say, expect teachers to sit in their home and live stream to 15 or 20 children like we're doing here with 38 the last time I counted. There's lots of issues of that around safeguarding and who's on the other end of the line and who's watching all the other children. And there's also issues around inclusion there. Does everybody have a device? Do all primary age kids have devices they can do that on? Especially at a time when their parents are probably working from home and using whatever devices exist in the family. So there's a whole set of issues around that push to get managers and employers to just relax a bit, understand that this is extremely difficult circumstances. People will do what they can. You don't need to keep putting pressure on them. And the second theme I mentioned was this business of not quite getting just how serious this crisis is and why we're in lockdown. So we've had a lot of arguments about shielding. I don't know whether other comrades here have had this, but people with vulnerable conditions, protecting them from demands that they come into work, protecting them from demands that they are part of rotas. And it's not just people who are vulnerable themselves, but people who live with people who are extremely vulnerable, who go home to houses where it's extremely important that the people they live with don't catch this bug because it's much more risky for them. And in most places, we've got acceptance that those people are exempt, but in too many places, that's still been a battle. And in some places, it's a battle that's not yet over. You got places where I got a school today, 6 weeks into the lockdown, where some support staff are being pressed to come in because there's not many kids, there's a lot of room. You don't often get this chance to have all this space to do your work. Again, missing that sense that the people are being locked down because unless it's absolutely essential, people shouldn't be going out, they shouldn't be traveling, they shouldn't be driving, they shouldn't be on public transport. And you've still got a lot of managers and employers that don't seem to quite register that that's the case, that if you're in work, it's because it's an emergency, because you have to be there and you're on some kind of rota and there's limited numbers. I just finished with a couple of positives, I think. Well, we've most of the things I've just listed, we've been winning on. And if one or two of them are things we haven't won completely on, but we've still gained on. So I get the impression from the other speakers and from other things that you pick up that this is the case across the trade union movement generally. So there's an issue that I think Joanne touched on just at the end of what she said, where we're going to have to, at the end of this, think, how do we make these wins permanent? How do we make sure they're not just temporary? But we have been winning on them, and people have seen that and seen the value of the union. And that's linked to the other positive, which is at a national scale, our membership's gone up by more than 5,000 in the first 2 weeks of the lockdown. And we've got about 350 to 400 extra reps out of this. And when we contact workplaces where there isn't a rep, we encourage people to become what we call COVID reps. Now, obviously, our intention will be to convince them after this that they should permanently be a rep. So we've got more and more places where there's workplace reps. But what that tells me is that people who've never seen it before are seeing the value of trade unions, saying how important it is, making more contact. The traffic to us is heavier than it is in a normal school term time. Again, I don't know what it's like for other comrades here, but I think there's an increased relevance of unions. Very, very finally, our next big debate and challenge is going to be the pressure to return early, because what we're picking up from the press and the media, and you must be picking up as well, is that there'll be a pressure for schools to be amongst the first that open. There's a narrative out there that because young people seemingly are less affected, schools are less dangerous places. But schools are full of adults as well as young people. Young people carry this and spread it, and then take it back we take it back to our families as well. So we're going to be very, very careful about the fact that schools shouldn't be opening until it's safe, till there's modelling, till there's testing, and that a lot of the things we've won already around shielding and so on should need to still be in place when schools open, so that the most vulnerable are not pressed to go to work, and people who are sick aren't pressed to stay in case they lose sick pay or get caught up in some sort of sickness absence process. So the battle will continue both over when they open, and also it'll continue when schools actually open. So I'll just finish there.
Thanks, Patrick. The Education Minister was saying this morning that they were in talks about how schools could return early. So I sort of assumed, this might be very wrong, that they were in talks with you. Well, who are they in talks with then, eh? Headmasters?
It won't be
Headmistresses?
I think there are discussions, but I think that as far as I know, that relates to, here are some questions to the unions and to employers and to head teachers and local authorities about the conditions under which you would open, what preparations would need to be put in place, how social distancing would work in a school. I mean, it's very likely that any return will be very phased, that only certain groups will come in at a particular time, that there'll be nowhere near the normal population of a school, because you couldn't possibly have social distancing in schools of hundreds and hundreds of pupils. I mean, we think anyway, our members tell us now that if you're in a primary school with early years children, you're not socially distanced even if there's 4 of them, because they run all over the place. You know, these are not people who can understand those kind of rules. So, I mean, I wouldn't call it talks with a capital T, but I believe there's some discussions going on about. We think schools should only open with our agreement, but that's not what the government's position will be.